Laser therapy was something relatively new for us in Australia. However, as a relatively new chiropractic location, we really wanted the edge. And one of the really important things for us was how can we provide even bigger benefits for our patients, right? And
looking into laser, it seemed not true. It seemed like, how could this be possible? After doing some research, we really figured out that this could be something we explored, and we did, and we're blown away by the outcomes.
Exactly, yeah. And so, what we're really looking for our patients is to provide the best quality treatment, fast quality treatment, something that is research-based, something that we believe in, that we are excited at, and something that is going to help us to stand apart from other chiropractic physios, massage therapists, and lasers. Yeah, provides that. That's a good one. I think that was like a few months after we decided to work together. And so I was like, okay, fine, I'm going to go to chiropractic conference and just see what's happening there. And as a part of chiropractic conference, there was a presentation on the lasers.
And there was many streams, and I wanted to go to a few of them. I'm like, Pavle, you go to the laser one. I want to know what that's about. So he went, he wrote his notes out, he got the
Lindy, you have to come and see this, forget about the other stuff. So that was the first time.
So I remember on our drive home from the conference, we looked into this and were talking about it, and we started to explore the idea of MLS Laser. And 6 months later, after information and research, that's how we came about buying our first laser.
Yep.
Confidence. As practitioners, sometimes by hands-on modality, you don't always have that consistency. Whereas later, you're going to get the same outcome, the same thing if you know what you're doing, of course, with the laser settings and things like that. And even then, you can't go too wrong. So we do find that has helped improve our business, improve our reputation. It's given us an edge over other clinicians, because as chiropractors or physical therapists or whatever, you do the similar things, but having the laser just sets us as being cutting edge, as being ahead of the times, as being research orientated, and that's what it has done for our business.
I would actually like to add one more. When we're looking for new chiropractors, right? While we're expanding new stuff, it is much easier to bring aboard people who want to further themselves, who are just on the ball, who are excited because we have additional modalities and they want to learn. And so, we stand apart a little bit also in the hiring process, because we're like, hey, we have something that is absolutely amazing. And it's easy to filter, those people who are really, want to go further. And with that, we have a better team culture, or we assume we have a better team culture, and just help us in overall. Yeah.
As a chiropractic clinic, we see mostly musculoskeletal conditions, so things like low back pain, neck pain, headaches, migraines, but most importantly, we do things like bursitis, tendinitis, muscle contusion, so sport injuries. With some of our patients that come in with other complaints and they might have some skin issues or lesions, we do help with those as well, even though that's not necessarily the chiropractic.
Our older patients absolutely love arthritis.
Arthritis settings.
That is something that is just bread and butter, and we really find that is to be...
reduces pain.
Exactly. Give them a range of motion. They can continue with their lifestyle, go walk with their friends and stuff like that. They really, really appreciate that. We found that to be like a really big one amongst the other things.
Surprise that it works, because it seems like most therapies, there's always a pain associated. So with musculoskeletal, you're touching something, you feel it, there's a sensory component. Ouch, that hurts, so it must be good. Laser doesn't hurt. You apply this laser, it's light, and yet your brain goes, is anything actually happening? And so when a patient immediately feels relief, and that's all you've done in that session, they're like, wow. They're in awe, they're surprised, and they then become great referrers because they truly...
They go and tell their friends, like increased range of motion and then pain reduction. It's two things that we really find that it's a...
So to answer the question, the wow effect.
Wow effect. Yeah, this one was really hard because there's so many things that you can actually connect to this one. But we finally, after a few minutes of deliberation, we found one.
Confidence.
I forgot what was the second one after so much time. Which one was?
Results.
Results, yes.
And innovation.
That's it.